In August 1996, Congress passed the Health Insurance Portability and Accountability Act, also known as HIPAA. This act required that the U.S. Attorney General and the Secretary of the Department of Health and Human Services establish a healthcare fraud and abuse control program. This program coordinates the efforts of federal, state, and local law enforcement agencies to fight healthcare fraud. One of the main objectives of the program is to support and encourage compliance within the healthcare industry. Baptist Health has always been committed to complying with all applicable federal, state, and local laws, rules, and regulations. We've developed and implemented policies and procedures, processes, and internal controls to help ensure that we consistently comply with the thousands of regulatory requirements. In September of 1997, the Board authorized the establishment and implementation of a comprehensive corporate compliance program covering all entities owned and operated by Baptist Health. A corporate compliance officer was appointed and was given full responsibility and authority for developing, implementing, and administering our compliance program. In addition, the Board appointed a corporate compliance committee, and they approved a code of ethical conduct. You will review a copy of the code today. The code translates our values into very simple standards of conduct. Every person and company employed by or associated with Baptist Health is expected to comply with the code. This expectation applies to our administrative staff, employees, physicians, other members of the professional staffs, students, volunteers, and major vendors and contractors. If you are a member of an administrative staff, a department director, a manager, or supervisor, you are responsible for ensuring that all individuals under your supervision clearly understand the federal, state, and local laws, rules, and regulations, as well as internal policies and procedures which apply to them, and that they understand that they are expected to comply. It's your responsibility to take steps to ensure that each person you supervise does so, and that you have processes in place to detect any instances of noncompliance. As a supervisor, you're also responsible for creating and maintaining a work environment which supports and encourages open and effective communication. The people you supervise should be comfortable communicating with you without any fear of punishment for good faith reporting. You're expected to address and promptly respond to all compliance questions and any concerns presented to you, and then to take corrective actions as necessary. At Baptist Health, consistent compliance and ethical conduct are not optional. The extent to which Baptist Health is in compliance as an organization depends greatly on your compliance, your commitment to practicing our values, and then your adherence to our code of ethical conduct. By working together in a spirit of commitment and living our shared Christian values of service, honesty, respect, stewardship, and performance, every day we'll have an effective corporate compliance program.
Hello, I'm Bill Watley, your Corporate Compliance Officer, and I'm here to talk to you about Baptist Health's compliance program and what it means to you and your job every day. At Baptist Health, we're committed to doing the right things for the right reasons, professionally, ethically, and legally. No matter what your job function at Baptist Health, our success as a quality provider of health care depends on you, your professionalism, and your personal integrity. Our primary commitment at Baptist Health is to our patients. Our primary responsibility is to provide medically necessary care, to submit fair, accurate bills for that care, and to prevent fraud and abuse in our healthcare system. Our very complicated and dynamic business environment demands that we provide care more efficiently and control costs. Since the government pays for the care of many of our patients, we must strictly follow the many laws and regulations that govern how we provide care and are reimbursed for it. These laws are complex and constantly changing. Our Baptist Health compliance process provides a structure to help us reach our goals and meet our legal and ethical responsibilities. Our program is modeled on the U.S. Office of the Inspector General's published compliance guidelines, and there are 7 elements. Element 1, Baptist Health's Code of Ethical Conduct and Written Policies and Procedures. So what is the Code of Conduct? It's a guide to ethical, moral, and legal behavior at work. You can use it to help you make decisions at work, especially if you run into a situation that's unclear or confusing. You'll be asked to read an acknowledgement form and to sign it to confirm that you understand and promise to abide by the Code of Conduct. This form will be part of your permanent employment record. Our policies and procedures describe the tasks, responsibilities, and standards for specific jobs based on best practices and relevant laws and regulations. When well-defined, they prevent worksite problems and help resolve them if they occur. For example, we provide only medically necessary prescribed services and products that meet our patients' clinical needs. We make sure that the frequency, amount, and duration of these services are appropriate. We measure clinical outcomes and patient satisfaction to confirm that our quality care goals are being met. We make sure that all clinical, financial, and other documents are completed correctly and promptly. Our patients receive care only from licensed and certified providers who have appropriate education and expertise. We do not discriminate in admission or access to care. We provide the same level of care to everyone regardless of race, color, religion, national origin, age, disability, or any other areas protected by law. Baptist Health does not tolerate discrimination of any kind. We do not tolerate verbal, mental, or physical abuse. We never deny care or attention to a patient or ignore patients' needs. We communicate with our patients and their families openly and honestly. They have the right to be fully informed about their conditions and either consent or refuse treatment. We protect and respect personal privacy of all our patients. All patient records must be kept confidential. Only people who have a legitimate reason for information may access patient records unless the patient is given written authorization. Because many forms and reports have the status of legal documents, they must be accurate, confidential, and properly maintained and protected. These include medical records, bills, claims, and invoices, data supporting cost reports, and records of our compliance process. Element 2. Baptist Health's compliance team. As Corporate Compliance Officer, I oversee the compliance program and how it's run throughout the system. I'm supported by the Corporate Compliance Committee, made up of key representatives from all Baptist Health entities. The compliance program is also supported by our senior leadership and the Board of Trustees. Element 3. Training and education. Each employee receives training about his or her individual compliance responsibilities during orientation and again during the year. If you work in clinical care, billing, or submission of claims, you will also receive specific compliance training related to your job. Your supervisor will tell you about your requirements and arrange for you to complete them. Element 4, the 4-step reporting process. For our compliance program to function successfully, you must be able to ask questions and report problems. Reporting compliance issues is a must, and it's everybody's responsibility. We will never allow anyone to punish or retaliate against you for making a good faith report about a compliance issue. In every situation, our employees' rights will be respected. Element 5, internal monitoring and auditing. Even a small or innocent mistake can affect patient care and compromise Baptist Health's reputation. We have internal personnel and external auditors who constantly review our operations, processes, record keeping, and reports to make sure we're in compliance. Element 6, corrective action. If an audit uncovers a problem or someone reports a compliance violation, we act quickly to investigate, devise a plan of correction, and resolve the situation. Element 7, disciplinary guidelines. These describe the consequences if you violate our Code of Ethical Conduct or our policies and procedures. They include warnings, suspension, or dismissal. If you suspect a compliance violation, do not report it. You could face disciplinary action as well. As you can see, the compliance program is a very comprehensive process, important to you and the way you do your job. In fact, adhering to our compliance process is a job requirement and part of every employee's annual performance review. Compliance violations hurt our reputation as a trustworthy healthcare provider. Making sure we're in compliance is everybody's business and an investment in our future. The compliance process helps us prevent fraud and abuse. It promotes quality care and sound business practices. You could say Baptist Health's compliance program is an investment in our future. Thank you for being a part of our compliance program every day.